Thank you, Professor. First of all, I would like to thank everyone here for, at least the agency, for inviting me to come back and see what they have been doing. I was here many years ago when the agency was being set up, along with the Deputy Minister and others, and it's very nice to see that they have survived and are actually making progress. Okay. I would like to talk a little bit about something called the International Road Safety Centre, and I will try to explain what this is and why it is necessary. I'll cover 5 main things. What is the problem? Where is the evidence that low and middle-income countries can be successful in improving safety? Why do we need something like an International Road Safety Centre? Because I think it can act as a bridge between countries to transfer knowledge and expertise. We want to talk a little bit about the kind of training that can be provided to countries, and how do we institutionalize road safety so it becomes sustainable? Because one of the big problems always in every country is financing, having the right structures, having the right political environment for safety. So I want to cover all of these, and it's based on partly, let's say, largely on my experience. I've worked in 65 countries now around the world on safety issues. Some successfully, some not so successful. And the idea is to try and learn those lessons and see how can we take things forward. Okay, so first of all, just a general picture. Now, earlier, Jonathan already said, okay, in Europe, that's the red countries. You've got everything from about 2 or 3, well, this is a little bit dated, but overall picture is red is Europe. And then you've got yellow is Asia-Pacific region, and then you've got green, Latin America, and then you've got going on to Africa with the blue. So you can see the range is huge, that in the European environment, we are the best in the world. As Antonio says, it's still not enough. We still have to do more. But in terms of the global picture of 190 countries, Europe has done exceedingly well. It's the best region. And that's much down to people like Antonio and others who have, at the European level, with the EU directives, they've pushed safety as a factor. And this has been a real important factor in making safety happen. So the consequence is that Europe has quite a good record, but there's many, many countries. Now, Jonathan was saying that it ranges up to about 18 in the European region, which is probably taking Russia or something that side. If you then go on to Central, or go into some Asia, then into Latin America, into Africa, you're talking 30, 40 deaths per 100,000 population. So there's a huge range globally. And there's clearly something happening here which should be transferable. Some of the techniques, methods, ideas, we've learned lessons. We know what the vaccines are. We know how to solve the problem. We know, for example, simple thing, safety belts. We know safety belts and speed. If you have to minimize what you do, at least do those 2 things. If you could have everybody wearing seat belts, front seat and back seat, I can guarantee you 20% reduction in deaths within a year. That's the kind of, it takes a political initiative and strong enforcement. Reduce the speeds, excessive speeds. You will again save deaths. We know what works, we know what is effective, but yet we are not applying those solutions. Those vaccines are not being applied. So it seemed to us that there was a need to have something that would act as a bridge across, taking some of the experience, especially by using the experience of those who have been applying and implementing things in developing countries or low and middle income countries, those who are successful. What can we learn? What can we share with other countries? If you take, just as an example, is it possible to do something? These were countries, ex-socialist countries, who all joined Europe. As a consequence of the pressures from Europe and so forth, all of them reduced their deaths and injuries. If you take this other group of countries, these are the ones, Kazakhstan, Kyrgyzstan, Uzbekistan, all of them, they still have much, much higher rates, death rates and injuries. They have not taken on board. So for me, one thing clear is countries within Europe have actually done very, very well. They managed to reduce. They still have to do more, but they have learned some lessons and they've applied those lessons, they've applied those techniques and methods and done something. But then those countries were actually because they were in Europe, they were required to, they were forced to do things. There's the EU directive, there's legislation, other things required them to do things. What about countries which weren't actually in Europe? If you look at this, again, I've tried to compare their countries within Europe and how they all managed to reduce deaths by 30, 40, 50% over a number of years. Serbia is outside Europe. It was not required to do anything, yet they were systematically copying or adapting things which were happening in Europe. They were smart enough to see, as professors and academics, to analyze the situation, to understand there are some things you can do. And in fact, Srpska is doing something similar too. You're learning the lessons, you're bringing them in and starting to apply them. And that's why, to me, it's very clear that it is possible for countries which are outside the European and the constraints and the legislation and all the pressures, it is possible for a country outside still to make quite dramatic improvements. This is Serbia. Again, just some of you are familiar with this, but just give you that from about 1,275 deaths over something like 14 years, they're down to about 500. 60% reduction in deaths over that period. This is not a rich country. It's far less rich than many of the countries I've shown you, socialist countries, Kazakhstan, Kyrgyzstan. Some of them have a lot more wealth. Yet, this country has managed to apply a systematic, a scientific approach, which European countries have been applying. And as a consequence, they've set up the right kind of management and coordination structures, the appropriate sustainable funding mechanism, and they've managed to do a number of things which have been helpful. So when I was looking around to see where it would be good to try and do something, I actually had a choice of going to several countries. And I've always felt Serbia is quite a useful role model because it's outside Europe, because it has demonstrated it is possible to do something. So we've actually set up the center in Serbia, actually, in Belgrade. And the purpose of that is, well, I'll try and talk about it. What is it? What will it do? And why did I choose Serbia rather than going off to the UK or Sweden or somewhere else? Because those countries are too far ahead. You need a country where people can come to and see that there are still people who were involved in this last 10, 15 years. If I go to the UK, the people who made safety happen there have all died. It was 50 years ago we started doing safety. And so all those people who made those major changes are no longer around to tell you what were the problems, how to do it. Whereas a country like Serbia, or even Srpska eventually, I hope, will be good role models where people can say, well, yes, this is how we did it. This is how we managed to do it. This is how we, for example, changed the police force from a socialist police force to a more interactive police force, which is guided by performance indicators. Right now, you're starting to collect performance indicators. Police can be deployed based on what is the problem in or which part of the country. Okay, so who are his partners and what organizations are involved? I'll talk a little bit about the potential faculty and lecturers. Let's say it's a virtual faculty. We don't have a large building or something, but we can draw people from around the world. And the purpose is capacity building, and it's aimed at trying to actually help countries. I'm not interested in doing consultancy contracts. We need to work with governments over a 3-year to 5-year period to help them bring up safety in a systematic way, rather than just going in, doing one small project, and again, everything is left and then dies usually after a couple of years, and then a new project comes in. And this has been the worst thing about my professional life, the number of projects where somebody has financed for a couple of years, then you say it needs to be continued. It takes 2 years before the continuation happens. And during that time, everything starts falling down again and has to be brought back up again. It's an up and down process. Whereas if you have a longer term, 3 to 5 year program of systematically building safety, I believe that can work. Okay, so how will we do this? What can be done? First of all, the center is a not-for-profit organization. Of course, the experts will have to be paid some monies, but the idea is not to make money on it. The idea is any funds we make will be put back into documents and circulated freely to people, trying to share our knowledge and experience. So the idea is that we will try to work with countries, help them, bring those kind of experts together who are needed, and cover all sorts of things. We will train the trainers and try to work with local institutions in the country. And gradually the documents can be translated to the local language so they can train other people. We don't want to be there forever, but we want to work with a country to help them develop systematically. Lecture materials, course modules, and even textbooks, we hope, will eventually be given to these countries to let them introduce safety into the universities and start training people and doing research. We're lucky that we've got support from good local partners in Serbia. We've discussed with some of the key organizations. One of them is the University of Belgrade, where Professor Christo is now the leading professor, and previously Professor Vunic, obviously. They've done a great amount of work in research. They've built up a great capacity of safety. They're training kids from first year right through to PhD level in road safety. And many of them have then gone on to Srpska or to Slovenia. They've spread around the region. And this is a good background. There's the Academy of Criminalistic and Police Study. This is actually the police academy. They are training the police in, as I said, things like performance indicators, how to use them for deploying staff. For example, if you find, let's say, surveys show that seatbelts are not being worn very highly in a particular police region, yet they are, or is below average of what's being worn elsewhere. Police at headquarters can actually start shouting at the commander or somebody in that section, saying, okay, look, why are you not doing as much on that performance indicator? So we actually are now deploying police activity actually based on road safety indicators, not just generally going out and being on patrol, but you're actually looking at the indicators and trying to target. You have limited resources. So this is good. They have the ability, and we can use that police academy to train police from other places. Navac Driver Training Center is probably one of Europe's best driver training facilities. It's absolutely amazing in terms of they train drivers in pursuit driving, they can train drivers in driver training, driver testing. They're very, very excellent. They have a huge range where they can take people for driving courses. The Serbian Road Safety Agency, one of our colleagues is here. They have done an excellent job over the last many years, actually, in being a model of what can be done. And as an agency, we were talking about funding, they actually make money. They actually make more money. They don't need government support. They're doing various services to the public. They make money, they can do safety activity, and return some money to government. I mean, this is actually quite a novel thing. That means that there's not the shortage of money as is in some countries. So they, again, have some expertise we think we can use. They have an excellent crash data system, and they are active, actually, with the local communities, pursuing and trying to help local communities, like you are here, in trying to do more safety. Automobile and Motorcycle Association, it's the Automobile Club. They I think, have something like 70 vehicle testing stations. So they are experts of vehicle inspection. And they are also experts in International Road Appraisal Program, IRAP. So they know how they have vehicles, they can go and test, check the network to see where there are potential dangerous locations. And they can provide that kind of service. Lastly, not least, is the PERS, Serbian Roads Administration. They are responsible for state roads. Now, all of these organizations are government organizations. Apart from the Automobile Club, they're government organizations who have taken responsibility for parts of the safety in Serbia and were incidental to that huge reduction that I showed you. They all did their part, and between them have managed to do this. In many of these places, the same people are there now 10 years ago who were actually there before this whole process of reduction started. So they have more knowledge, they have experience, they can actually talk to people about what they did, what were the problems, what difficulties they had. Recently, we brought people from about 10 countries on a study tour to Serbia. And one of the things was we took them there, we actually took them, did some lectures in the mornings, and then we actually, in the afternoons, they went to visit these people, so they could talk directly. Policemen were talking to the policemen. Well, how did you do this? How did you change the structure of the police to be more oriented? And they talked to the roads people. Well, how did you introduce road safety audit, road safety impact assessment, etc.? So they were able to talk directly to the organizations and the people involved. So there is not just experience and expertise, but there is a recent experience of having improved an organization. And that's very valuable to somebody who's thinking about improving, so they can see what kind of improvements can be done. We've also got potential regional partners. We will work with CETO, TRASECA, BSEC. There's a number of Eastern Partnership. These are organizations to whom we're having some discussions, saying, okay, we are available. If you need some help or assistance, let us help you. And even global partners, some of the international finance institutions, etc. The kind of people who are involved, obviously there's myself, there's Professor Christo, there's other engineering side, Dejan Jovanov, he's excellent road safety engineer. There's Dusan, who is a vehicle inspection specialist, and also the Milan, who's head of the police training. So we've got all of these kind of people who are available. But more importantly, if you look at the red lines, you can't see them very well. Some of the major leading safety experts around the world have agreed to be participating if we need them. And people like Rune Elvik and others, I mean, these are world-known people as the most top experts in road safety. And all of them have, because I know them, we've worked with them before, they've all agreed to provide some help should it be needed on a particular country. And we're actually talking to a number of countries trying to see what we can do, how we can work in partnership with these places. Okay, who are the targets? Well, obviously we want to train the key officials who can manage and implement programs. We want to train the local instructors who to deliver the kind of courses in local language if possible. And we want to mentor academics to help the universities to start introducing road safety research, so we have a scientific approach to safety in a country, plus teaching the young engineers, so we build up a capability in the long term of locally based and local national experts in a country. We want to create a framework of knowledge, so better policy making. Right now, many countries, like the ones I showed you, there's really no policy making. Nobody is making informed decisions. They don't know what to do because they have not got the academic background or scientific research to help them do it. IRC training can be done either, as I said, in Belgrade, or we can actually go to the country concerned. Again, I'm not going to go into detail, but basically covering all 5 sectors, all 5 pillars of the decade, which is safer roads, safer vehicles, safer road users, post-crash, that's emergency services, and road safety management. So we can actually provide some guidance and help in all of those areas. Sustainability. First of all, we need to mobilize political will to take action. You know yourselves from here that unless you have, at ministerial level or higher even, support, you're not going to get the resources you need. One of the ways to do that is to persuade them of the huge economic losses being incurred. Right now, Srpska is losing 80 million euros every single year. 80 million. Now, about 1/3 of that is actually in cash. 2/3 is longer term to do with GDP, etc. So 1/3 of that even, let's say 25 million even, is something that could be used in your health services or to improve your education. It just seems to be money which is being wasted because not enough is being invested in saving and doing safety. You need good legislation to define who is going to be responsible. You need very effective management and coordination structures. And again, you're lucky. You've actually got at least a road safety agency. For example, the Federation still does not have a road safety agency, although they started, I did work there in 2011, and I think it was 2012 in Srpska. So Srpska's moved faster. They've set up the agency, but the Federation still has not set up a road safety agency. And without that, nothing is happening. Nothing will happen, because there's nobody to take responsibility and action. Sustainable funding mechanism is really important, and I really worry at the moment about Srpska. Previously, you've had some money, small amount of money, but some money coming from the insurance industry. I have been told that that has now stopped. And I think this is a dreadful problem, because you've done quite well with the very small amount of money you had. And unless the insurance industry is made to put more money in, because in other countries it's quite normal. Insurance industry provides some money for safety because they will get the benefit. Less accidents, less injuries, I mean, they pay out less. But just in the first couple of years, they have to pay some money into the system. and then they get the benefit 2 or 3 years later. Right now, I think this is something I would certainly, if there's time, we should have some discussion on, because I think this is a really important point for Srpska, for the future, because otherwise the benefits you have had over the last 8 years could be lost because there is no funding, not enough funding to deal with it. Crash data system is extremely important to provide a scientific approach so you can analyze data. And again, you're lucky, you've actually managed to set up quite a good data system, whereas other parts of Bosnia and Herzegovina have not yet managed to do that. So again, you're a step ahead, but still more to be done. Universities, as I said, I believe very much in terms of sustainability. We have to start developing local road safety research. When they started in Serbia, nobody was willing to pay for research. But the university started doing research. They started to show their value by doing the research. Government started to take notice that this is actually interesting, useful. We can use this for making policies. And now they get a substantial amount of money every year as a university to do research on behalf of government or the Road Safety Agency or others, because it is recognized that this research is helping to make more effective policies. Plus, of course, teaching young engineers, getting them interested, getting them to know about safety is also very important, and we need to bring this younger people into the system. Last and not least is this, what I would call the extensive, systematic capacity building program in all key sectors. And this comes back to what I said before, that I believe it needs to be done not as a one-off, but a systematic thing, strategically, over a 3 to 5 year period, where a country says, okay, let's look at what we need. Let's draw up a plan of how we can improve safety. What do we need to do? And then we are happy to work with them on that. I think that's, okay, that's all. So basically, I would like, as I said, if we have time, to talk a little bit about the funding. That's something I think is important, if you have time. But otherwise, thank you very much. Thank you for listening.